I love the scapula. I love what it can do. Take a look at Kara Winger, 3-time Olympiad, doing what she does best, throwing the javelin. So much power, all situated here in the shoulder. We're looking at the posterior or back view of the scapula. Here's the spine. These are fossa, flat areas for muscle attachment. And then we have the borders. Lateral on the shoulder side, medial, superior and inferior angle. The acromion process, that knobby bone area near the shoulder, below it, the coracoid. All right, now let's look at some deep muscles. We'll start with the supraspinatus. So there's the spine, and there's a supraspinous fossa. So coming off from here, we're going to abduct the arm. Abduct means pull away from the body. Now there's an infraspinatus under the spine that's going to help with lateral arm rotation. Infraspinatus. All right. Teres Major, another deep muscle. It's on the surface of the inferior angle of the scapula, and it's going to adduct or pull away and medially rotate the arm. All right, I think you're getting the picture here. Our ancestors would be dead if they couldn't move their upper arm effectively. And so we have many muscles that are dedicated to movement of the arm by attaching it to this anchor called the scapula. Okay, let's look at some other deep muscles. We need to lift the scapula sometimes, so we have the Levator Scapulae. It's on the superior medial border, and it makes sense. If you want to lift the scapula, that's a perfect location, attaching right there. Now how about the rhomboids? Because there's times when we need to bring our scapula inwards or medially to the center of the back. So we have a minor and a major coming off right about there. Retract, and there's some rotation taking place as well. Now we get to the large superficial muscles. Trapezius. It's extending from the acromion. It has many attachment points, by the way. And it's going to elevate and rotate the head and do a lot more. Trapezius. We also have the latissimus dorsi that's going to attach at the inferior angle, and it's going to extend, adduct, and medially rotate the upper arm. So there you have it. A lot going on in the scapula. Well, one way to get in touch with your scapula is to do some activities, and I did these myself. I was carrying a dog food bag, and I sort of stopped for a second or two and thought about what muscles are engaged. I could feel my trapezius, and I could feel that levator lifting the scapula, and I could imagine my rhomboids. Then I pulled off my shoes. A little different action. I had a little side twisting, so that was the latissimus dorsi. Teres, maybe rhomboids, we have to do some guessing here. On to sweeping the kitchen. Kind of small movements, so I think the infraspinatus, supraspinatus were engaged. Latissimus dorsi, I'll scratch my back. Teres Major, both are rhomboids. So when you're done with this lab, you just have a little everyday movement chart, and then you have your beautiful drawing that may not make sense at first, but when you get your labels in there, you'll start to appreciate the fabulous scapula.